Well, sadly, this is the last stop on our tour of beta-lactam antibiotics. But traveling through hyperspace ain't like dusting crops. You should be proud of making it this far. Our last beta-lactam planet is home to the monobactams and carbapenems. And though it's kind of known to be a wretched hive of scum and villainy, it's also a pretty convenient stop to pick up some power converters. So let's check it out. Once again, we have our beta-lactam ringed planet in the distance, as well as our death coccus under construction to represent the bactericidal mechanism of action of beta-lactams, as they halt peptidoglycan synthesis in the cell wall. This is by binding PBPs, which were the construction workers from before. In this interplanetary junkyard, our first beta-lactam bot is aztrionam. It's a monobactam antibiotic. Monobactams consist of a single beta-lactam ring, as represented by our somewhat cute one-eyed repair android. Their spectrum of activity is limited to aerobic gram-negative rods, with no activity against gram-positive bacteria or anaerobes. To convey this, we can see that our monobactam repair bot is using bellows. This is our recurring aerobic symbol, and it looks like he's using it to dust off the inner circuitry of the robot he's disassembling, which is of course a red gram-negative rod shape. One important aerobic gram-negative rod that monobactams combat is Pseudomonas, and in the center of the repair yard, we see our first customer, that android with the enigmatic smile, resembling of course Mona Lisa, our recurring symbol for Pseudomonas. The gram-negative coverage of aztrionam is similar to that of third-generation cephalosporins, and it penetrates well into the CSF. Therefore, it can be used to treat serious infections, such as pneumonia, meningitis, and sepsis caused by susceptible gram-negative pathogens. Take a look at the next inoperable bot in the line waiting for repairs. It has our recurring red meningitis mohawk helmet, a rusty lung-shaped chest plate, and is red all over, our theme for gram-negative, in order to emphasize aztrionam's ability to treat serious systemic infections caused by gram-negatives. This is especially important in patients who have a history of penicillin anaphylaxis, because there's no immunologic cross-reactivity with monobactams. So this inoperable bot also has some previous damage done by penicillins, as shown by this purple pencil saber still lodged inside of it. Don't worry though, even with penicillin allergy, aztrionam has got you covered, no questions asked. One more thing to mention about monobactams. They are resistant to most beta-lactamases, and as you can see to the right, one of these cute little junkyard dog bots is scaring off one of the beta-lactamases. They do have the right to refuse service to anyone. And remember that this ring shape on the gun represents that beta-lactamases are encoded usually by plasmid genes, and it's a gun because they usually cleave beta-lactams. Alright, so this reputable establishment doesn't just fix androids. On the other side of the lot is Amy's hovercar repair. Let me introduce our last class of beta-lactams, the carbapenems, examples of which include doripenem, ertapenem, imipenem, and meropenem. Now these drugs have a broad spectrum with good activity against anaerobes, gram-positives, and gram-negative rods, including Pseudomonas. Our customer with that uncanny resemblance to Mona Lisa symbolizes Pseudomonas coverage from both carbapenems and monobactams. To highlight the broad spectrum of action of carbapenems, we've got this cool prism hood ornament on the front of this funky interstellar cruiser. Notice the broad spectrum rainbow. Also, this woman here working under the hood is wearing a gas mask, emphasizing carbapenem's anaerobic coverage, important when treating aspiration pneumonia or intra-abdominal infection. Not only do carbapenems have a broad spectrum of action, they penetrate body tissues and fluids well, including CSF. So they are one of the big guns at your disposal. Remember, whenever you see our broad spectrum prism, Along with our Pseudomonas monalisa, rest assured that this is one of your big gun antibiotics used for the treatment of serious infections, such as hospital-acquired pneumonia or the empiric treatment of sepsis. Take a look at the Amy's Car Repair slogan, "When others fail, we get the job done." Remember that. Carbapenems are indicated for infections caused by bugs that are resistant to other available drugs. Also, to remind you that carbapenems are sometimes used for meningitis, we'll sketch in one of Amy's helpers, and he looks a little predisposed, but he's wearing the recurring red meningitis mohawk helmet, a standard workplace safety requirement. Alright, take a look at the engine under the hood. Notice it looks like a renal tubule. Turns out that imipenem, represented by Amy here, is inactivated by dehydropeptidases in the renal tubules. So it's administered together with an inhibitor of dehydropeptidase, celastin. As you can see, she's topping off the engine with some celastin motor oil. Keep it lastin' with celastin. It's not copyrighted or anything. You can use it if you want. There are a few adverse effects to keep in mind when working with carbapenems, which are more associated with imipenem. The most common are skin rash and GI-related side effects. This includes nausea, vomiting, and diarrhea. This will be represented by one of Amy's repair droids lying in a diarrhea-esque mud puddle, which is our recurring symbol for diarrhea. And because rash can be involved, we'll make him full of red rust spots. Who repairs the repairman? You know what I mean? Also important to keep in mind with imipenem is lowering the seizure threshold, especially in patients with renal dysfunction. And it looks like Amy's second repair android forgot to ground himself before touching the power converter. Let his sketchy action lines remind you of seizure. Like monobactams, carbapenems are highly resistant to beta-lactamases. Furthermore, clinical experience suggests that carbapenems are the treatment of choice for serious infections caused by extended spectrum beta-lactamase producing gram-negatives, such as E. coli and Klebsiella. These extended spectrum beta-lactamases are a growing clinical concern, and carbapenems may be one of your best options for treatment. Notice in the back, we have again beta-lactamases trying to sneak in. But these are extended spectrum beta-lactamases, as represented by their matching and surprisingly complementary rainbow jumpsuits. Well, I hate to say it, but our tour of beta-lactams has come to a close. Let's sum up this sketch. Monobactams can be your go-to drug to treat serious systemic infections caused by aerobic gram-negatives, including Pseudomonas. And remember, it can be used in patients who have a penicillin allergy because there's no cross-reactivity. Over on your carbapenems side, these are your big gun antibiotics also used for treatment of serious systemic infections, but they have a broad range of coverage that includes Pseudomonas and anaerobes. If you're using imipenem, remember to keep it lastin with celastin because it gets inactivated in the renal tubules. And watch out for that lowered seizure threshold. And extended spectrum beta-lactamases, carbapenems have got your back. Well, there you have it. Fingers crossed for the sequel. I'm not gonna lie, I'm kind of not ready for this to end. That Amy person, why is she hiding out here where no troopers are allowed? She got some kind of royal relation to Princess Ellen? Are they fading me out? They're fading me out. May the sequels be with you.